anatomy of lungs. We had dealt with the topic up to the relations of the medial surface of right lung. So today we'll be starting with the relations of medial surface of the left lung, and then we'll do a few more extra points to just complete this topic. So first we'll just have a small revision about the structures at the hilum of right and left lung. So can anyone name the structures at hilum of left lung in order from superior to inferior? You can take the help of this diagram.
Left pulmonary artery.
Yes.
Superior pulmonary vein, inferior pulmonary vein.
Okay. Between pulmonary artery and the vein, you have to mention the bronchus also. Anyway, good effort. Okay. Remember the code ABV from superior to inferior. Whereas for the right lung at the hilum, the code was BABV, that is eparterial bronchus, pulmonary artery, hyparterial bronchus, and pulmonary vein. Now, why I'm stressing on these features is because only if you know this order, you'll be able to identify these structures in your dissection specimen also. Otherwise, it can get a bit confusing to identify which is pulmonary artery, which is the pulmonary vein, because it's a little new for you when you see the specimen. Also, one more fact I want you to learn is not only the order of structures from superior to inferior, but also from anterior to posterior. So you just look at this key. It tells you this is the anterior aspect of hilum of left lung. This is the posterior aspect. So anterior to posterior also, we follow the same code A, B, and V. And this V, we actually refer to the inferior pulmonary vein. So we'll just look at it anterior to posterior. First comes pulmonary artery, then the bronchus, and posterior most is the pulmonary vein. For right hilum also, from anterior to posterior, this is the anterior aspect. The structures will be A, B, and V. From anteriorly, there's pulmonary artery, the bronchus, and pulmonary vein. So please learn this today itself. What is the order of structures at hilum from superior to inferior and from anterior to posterior? That will help you to be clear with the specimen as well when you see it in offline class. Now let's look at the structures which are related to the mediastinal surface of the lung. So I had mentioned, you have to imagine, suppose you have a piece of clay. Any object you place on top of it or close to it can form an imprint or an impression on that pliable clay. So in the same way, the lungs are closely related to the structures in the mediastinum. Since the lungs are a soft and spongy structure anatomically, the structures in the mediastinum will form an impression on the lung parenchyma. So that is what we are learning. We look at the left lung today. The left lung is mainly related to the arteries, as you can see in this diagram. This is the arch of aorta, which will lead to the descending thoracic aorta. And here is the left border of the heart. So looking at this diagram, can you tell me left border of the heart is formed by which chambers of the heart? Just a small revision. So the left border here, it's formed by which chambers of the heart?
Left atrium and left ventricle.
Yes, good. Yes, I'm seeing the answers in the chat as well. Good. There's left atrium and the left ventricle. Good. Also, I want you to remember one more part here. The right ventricle will lead into the pulmonary trunk, and this region is called the infundibulum of right ventricle. So the infundibulum is also an important structure which will be related to medial surface of left lung. And here we can see the arch of aorta, which will continue as descending thoracic aorta. Now we need to learn what are the branches of arch of aorta. So can you name the branches in order? Anybody? Name the branches of arch of aorta. This is the arch of aorta. What are the branches? This is a frequently asked question for you. So let's get used to answering it now.
Brachiocephalic artery,
Yes, good.
subclavian artery,
Yes,
common carotid artery.
okay, good. So now you have to mention whether it is right or left. Okay, so brachiocephalic artery or brachiocephalic trunk is on the right side. The next two branches, you have to mention it as left common carotid artery and left subclavian artery. Okay, class, so please keep in mind the three branches of arch of aorta are brachiocephalic artery, left common carotid artery, and left subclavian artery. So the structures, the branches which are towards the left side are what will be forming impressions on medial surface of left lung. And of course, in the posterior mediastinum, posterior most, there will be the esophagus. Now the trachea, though it is mostly in the midline, there is a slight deviation of trachea to the right normally. You will learn that along with details of trachea. So when you are talking about impressions on medial surface of left lung, we mention the esophagus mainly. And posterior mediastinum also has one more important structure related to the left lung. It is a lymphatic vessel, which is known as the thoracic duct. So this is the diagram for relations of medial surface of left lung. When you draw the hilum, draw the structures in order. Now we can see the left lung is related mainly to the arteries. Keep that basic fact in mind. So here is the arch of aorta, the impression made by arch of aorta, and this is the descending thoracic aorta's impression. From arch of aorta, here are the two branches on the left side, which is the left subclavian and the left common carotid artery. Next, posterior most over here, there will be the area for esophagus and thoracic duct. Area for esophagus will also extend downwards vertically. This region is the relation to the heart. Here is an area for left ventricle, and this is an area for infundibulum of right ventricle. I think in your textbook, it will also be mentioned a small area for the left atrium. So you can learn that accordingly. Right. So learn this diagram today itself. In your SDL topics, you can write these answers as two separate answers, just a neat labeled diagram showing the relations of the medial surface of right lung and left lung. All of you can draw both these diagrams in your SDL notebook. You all know we've been learning that the trachea is the content of the posterior mediastinum. And you know it already that the trachea divides into two main bronchi, the right and left main bronchi. So my question is, at what level does the trachea bifurcate? You may have learned this. in osteology class. Yes, T4, or in relation to the sternum, what level is it? Yes, the sternal angle. Very good. It's at the level of sternal angle. Another name for sternal angle is angle of Louis. So does anyone know any other event which occurs at the sternal angle? Can you name at least 2 more events which occur at the sternal angle? Anyone with the answer? What are 2 other events which occur at the sternal angle? Yes, the formation of aortic arch. Yes, good. Division of the mediastinum into superior and inferior mediastinum. Yes, it's actually the formation and also the termination of aortic arch is at level of sternal angle. Okay, good. So please read this from your textbook. There are at least 7 to 10 events in total which occur at the sternal angle. At MBBS level, you need to be able to list at least 5 of them. So learn that today itself, what are the events which occur at sternal angle. Now let's look at the division of the trachea. At level of sternal angle, trachea divides into right and left main bronchi. Now this right bronchus is shorter, wider, and more vertical than the left bronchus. So the clinical importance of that is that any foreign object can get easily lodged within the right bronchus, because if the person chokes on a piece of food, or if a child chokes on a small toy, from the laryngeal inlet, the foreign body will fall through the trachea, and because right bronchus is more vertical, the foreign body has more chances of going and getting lodged in the right bronchus. Okay, and finally, the main bronchus will divide further into secondary bronchi. Secondary bronchi will further divide into tertiary bronchi. Another name for tertiary bronchi is segmental bronchi. And finally, the tertiary bronchi will divide into smaller bronchioles. Okay, so this is just a basic information. You need to know the subdivisions of the bronchi. This will help you in your histology classes as well when you're learning the microscopic structure of the lung. So focus, the important feature we're going to focus on today is the tertiary bronchus, also known as segmental bronchi. This is a little more in detail for those who are interested to learn a little more, just that the tertiary bronchus will actually divide into lobular bronchiole. The next division is called terminal bronchiole. And finally, the respiratory bronchiole. Respiratory bronchiole will further lead to alveolar duct and alveolar sac. This will be dealt with in physiology class as well. If interested, you can learn all these minor details, but at least the major classification of the branching pattern, all of you have to know. So why are we focusing on tertiary bronchi or segmental bronchi? Because the lung is divided into smaller structural and functional units, which is called the bronchopulmonary segment. So the bronchopulmonary segment is a segment of the lung that is aerated by a single tertiary bronchus. Okay, this is a highly important part of the topic of lung. It's frequently asked for you. Each lung, the right and left, has 10 bronchopulmonary segments in total. So this is the right lung. Can you name the fissures of the right lung? Anyone? What are the fissures of the right lung?
Oblique fissure.
Yes. Good. Yes, oblique and transverse fissure, or oblique and horizontal fissure. Okay, thank you. So the right lung has 2 fissures and 3 lobes, whereas the left lung has 1 fissure and 2 lobes. So this is the trachea dividing into the principal bronchi. And finally, this is the tertiary bronchus. So each color is 1 tertiary bronchus. So you have to imagine that each of these tertiary bronchi will be supplying 1 segment of the lung. So that is how the lung is divided into different bronchopulmonary segments. 1 segment of lung which is aerated by 1 terminal bronchus. So what is the importance of this is that the bronchopulmonary segments, they are separated from each other through connective tissue or areolar septae. That is why it is called a structural unit. Anatomically, the bronchopulmonary segments are separated from each other by connective tissue. So what is the clinical importance of this? If the patient is suffering from any lung disease, which is affecting a particular bronchopulmonary segment, that segment can be removed surgically without disturbing the other bronchopulmonary segments. So that is the surgical importance of bronchopulmonary segment. Okay, so this is just a revision we already mentioned. So you need to know the lobes and fissures of the lung because we are going to learn what are the bronchopulmonary segments within each lobe. Okay. So I'll tell you the bronchopulmonary segments of the right lung. Pay attention. And one of you have to tell me what are the bronchopulmonary segments of the left lung. Okay, they have similar names. So let's see if you can get it. Yes. So for right lung, this is the superior lobe. So I want you to correlate that with this diagram of bronchopulmonary segments as well. Okay, so in this diagram, this is the superior lobe. What is the segments are labeled as 1, 2, and 3. So the superior lobe of right lung, the name of the bronchopulmonary segments are apical, anterior, and posterior segments. Now let's look at bronchopulmonary segment of the middle lobe. For the middle lobe, the bronchopulmonary segments are labeled as 4 and 5, which is medial and lateral bronchopulmonary segments. Inferior lobe has the most number of segments. That is what is labeled as 6 to 10. Okay, so inferior lobes bronchopulmonary segments are apical, and it's named as anterior basal, posterior basal, lateral basal, and on medial aspect of lung, there will be a medial basal segment as well. Okay. Okay, just tell me, do you see any difference in the right and left lung? Okay, what is one obvious difference between right and left lung in terms of its lobes?
3 lobes in right and 2 lobes.
Yes, good. You already know that there are 3 lobes here in the right lung and 2 in the left. Is there any special feature on anterior border of left lung? Yes, there is a cardiac notch and there is the lingula on anterior surface, on anterior border of left lung. There is the cardiac notch and lingula. Good. I'm happy to see all of you answering in the chat as well. Keep it up. Okay. So let's look at bronchopulmonary segments of the left lung. Most of these segments are the same as the right, except the left lung has no middle lobe. Okay, so for upper lobe, superior lobe, the first 3 bronchopulmonary segments have the same name as the right. Okay, so 1 will be apical lobe, 3 is anterior lobe, and 2 is posterior bronchopulmonary segment. Sorry, 1 is apical segment, 3 is anterior segment, and 2 is the posterior segment. Whereas this 2, which is labeled as 4 and 5, because it's related to the lingula, they are named as superior lingular segment and inferior lingular segment. Now for the inferior lobe, can you name bronchopulmonary segments of inferior lobe? It is the same as bronchopulmonary segment of right lung's inferior lobe. Okay, can anyone name the bronchopulmonary segments, which is labeled as 6 to 10?
6 is apical.
Yes, good.
7 is medial basal.
Yes, good. Very good, Malavika.
8 is anterior basal.
Yes,
9 lateral basal.
yes,
10 posterior basal.
yes, good. Very good. Good class. So please just revise this. Once you learn this diagram and you correlate with lobes of the lung, I hope you will be a little more familiar with naming these bronchopulmonary segments. So here, medial surface of lung, you can see the bronchopulmonary segment named 7, which is medial basal segment. So one question that is frequently asked for you is, what are the bronchopulmonary segments within the lingula? Okay, lingula can be pointed as a spotter for you. And the question that we usually ask is, name the bronchopulmonary segments present in the lingula. So what is the answer for that? What are the bronchopulmonary segments present within the lingula?
Superior lingular and inferior lingular.
Yes, good. What about another question that is asked is, what are the bronchopulmonary segments present at the apex of the lung? We learned about lung apex last class. So sometimes the apex will be pointed and we'll be asking, what is the name of the bronchopulmonary segment at the apex? So what would be the answer? Yes, apical, or you should specify it as upper apical. Okay. Yes, apical is fine. Yes, good. Okay, thank you students for your answers. In your textbook, this table will be given, but I would suggest don't try to study this table by heart. First, study the diagram. Okay, once you study this diagram and the orientation of bronchopulmonary segments, then this table will help you to just summarize. Okay, so please, you should learn the number of bronchopulmonary segments within each lobe, and you should name them in order with diagram. When you're learning the diagram, at least learn bronchopulmonary segments in lateral view. If you're able to, you can learn medial view as well. But all of you should know definitely bronchopulmonary segments in lateral view. Okay. Almost a sure question in your exam. Now, what is the shape of a bronchopulmonary segment? Okay, just look at this bronchopulmonary segment 3 in the right lung. Can you tell me what is the shape of the bronchopulmonary segment, a single segment?
Conical.
Yes, conical. Yes. Now, conical in shape, the apex is pointing towards hilum of lung and the base is pointing towards the costal surface. So these are points you can include for your short note. Apex will be pointing towards the hilum of lung, and the base of the bronchopulmonary segment will be pointing towards the costal surface. Okay. Now we look at what are the contents of bronchopulmonary segments. There is, of course, the segmental bronchus, then an artery. The artery is the pulmonary artery and also a branch of bronchial artery. So So please keep this in mind, okay? Within the bronchopulmonary segment, the content is the segmental bronchus along with pulmonary artery and a branch of bronchial artery. Okay, so this is the bronchopulmonary segment, which is pyramidal or conical in shape or triangular, as some of you said. Okay, these dotted lines represent the border of the bronchopulmonary segment, and there is an intersegmental plane between two adjacent bronchopulmonary segments. Okay, this is an intersegmental plane which is made of connective tissue. Within the intersegmental plane, what is passing through is the intersegmental veins. Okay, so you should know this point clearly. In the intersegmental plane, what is present are the veins, whereas inside the bronchopulmonary segment, the artery and bronchus is present. Okay, this is a diagram given in your textbook. Okay, this is the segmental bronchus. Accompanying it is bronchial artery, and this blue color structure is segmental pulmonary artery. Okay, even though it's pulmonary artery, it is labeled or colored with blue because pulmonary artery carries deoxygenated blood. So these contents are within the bronchopulmonary segment. Whereas over here, the intersegmental structure is the pulmonary vein. Okay, so please keep that in mind. Pulmonary veins are intersegmental. Pulmonary artery is within the bronchopulmonary segment. Fine. Now this is an easy question. I just want to ask you, what is the function of pulmonary artery and pulmonary vein? Okay, or it carries what kind of blood from where to where? Okay, very easy question. Make your biology teachers proud and answer this question. Anybody?
Blood is carried by pulmonary artery and the oxygenated blood by blood vein.
Yes, good. So pulmonary artery carries deoxygenated blood from where to where? Yes.
From
Yes.
the tissues to the lung.
No. Yes, tissue meaning from the heart to the lung, basically. Yes, good. Thanks for answering. And pulmonary vein carries oxygenated blood from where to where? Pulmonary veins will carry it from?
Lung.
Yes,
Lungs
from
to
the
heart.
lung. Yes, back to the heart, to the left atrium. Okay, so you know that already, the function. Which vein carries oxygenated and which carries deoxygenated? Just have to know that fact. Okay, you can include that also in your answer. Now, bronchial artery will actually provide nourishment to the bronchi itself, to the bronchi and to the lung parenchyma. Right bronchial artery. Right bronchial artery is a branch of which artery, according to this diagram? Anyone? Yes, intercostal artery. Good. What about left bronchial artery? These are the left bronchial arteries. Left bronchial arteries are a branch of what?
Aortic arc.
Yes, it's actually more specifically the descending thoracic aorta. Very good. Okay, so thanks for that. Right bronchial artery, it's more specifically from first and second posterior intercostal arteries, whereas left bronchial artery, it's branch of descending thoracic aorta. Now, right bronchial veins, they are tributaries of azygous vein, and left bronchial veins are tributaries of accessory hemiazygous vein. You will be learning this along with posterior thoracic wall. I'm just mentioning it to you today. This is given in your textbook as well. Those who are interested can learn. Okay, but usually it is not asked for you. It's a higher level question. Lymphatic drainage. Just know that the lung has two sets of lymphatics. Superficial lymphatics is just beneath the pleura, whereas deep lymphatics are within the lung parenchyma. Superficial and deep lymphatics together, they drain into a group of lymph nodes at the hilum called bronchopulmonary lymph nodes. From bronchopulmonary lymph nodes, the lymph will flow into tracheobronchial lymph nodes and paratracheal lymph nodes. Okay. Again, out of all this, at least if you learn the names of the lymph nodes, that would be enough. Only those who are really interested can learn the entire lymphatic drainage. Now, this is important for you clinically, but usually for first year anatomy, it is not stressed upon. Okay, very rare chance that it will be asked from exam point of view. At least the names of the lymph nodes you can learn. Finally, we come to the nerve supply, which is from pulmonary plexus. Now, as you are learning thoracic organs, okay, they're all viscera. So the organs' nerve supply is usually by sympathetics and parasympathetics. So can you tell me what is the action of the sympathetic nervous system on the bronchi? Okay, I told you earlier, the sympathetic nervous system is activated in fight or flight response. So imagine if you're running away from a dangerous wild animal. What will happen to your bronchi? Because the body wants to help you to escape that situation. So
Dilation.
yes,
Dilation.
yes, good. There is bronchodilation. Sympathetics will produce bronchodilation, plus there will be decreased bronchial secretions as well. Whereas parasympathetic nervous system is activated when you are relaxing. Okay, it's called, if sympathetic nervous system is for fight and flight, parasympathetic nervous system is for rest and digest. Yes, so what is the action of parasympathetic nervous system on the bronchi? It's the opposite.
Constriction.
Yes, so bronchoconstriction. Okay, thank